A health check alert to update you on right now. Rhode Island Hospital wants recent patients to know that they might have come in contact with the disease.
Now, this has to do with a patient in the ER a little more than a week ago. He came in around 3 o'clock in the morning, June 22nd, with a fever. He left 3 hours later against doctor's orders. Well, now the health department is worried about other patients who may have come in contact with him. Dr. James McDonald from the Rhode Island Department of Health joins us now. Dr. McDonald, thanks for coming in.
Oh, thank you for having us.
Yeah, one man comes into the Rhode Island Hospital ER. He's sick, he's not feeling well, he leaves, right?
Yes, sir.
Now, he doesn't present with measles. He's not coming in with the dots at that point.
Well, you know, I think as far as we know, he developed the rash while he was there, and that's when he left soon after that.
Right.
And really the key thing here is measles is not very common. This is our first case this year in Rhode Island. We only had one case all of last year, so it's not a very common diagnosis to make in this state.
Right. I know that we had an earlier case where someone went in with measles and the hospital let him go, and your health department came down on Rhode Island Hospital for not doing enough to keep him and treat him. Was that the case this time around?
It doesn't appear that was the case, and I think in this case, you know, both hospitals handled it appropriately. Roger Williams in particular, you know, was all over it. You know, they even called me that night and said, hey, we're suspicious, what should we do? Order the appropriate blood work, and I think they did a really good job in isolating this case. You know, measles is very contagious. Most of us have had the vaccine though, maybe not once, but twice at least.
What if you haven't?
If you haven't had the vaccine and you're born before 1957, you're considered generally to be naturally immune because you probably had measles. It was just that common in the United States. However, if you're curious about that or worried about that and you're born before 1957, there's generally no harm in getting the measles, mumps, or rubella vaccine. And if you have doubt whether you had the vaccine or not, it's something you should bring up with your health care provider.
Okay.
Just a point of clarification, he went to Rhode Island Hospital first, the ER, he left, and then he went to Roger Williams.
That's right, he did.
That's why you're mentioning that.
And right now, both hospitals have contacted those who are affected in the emergency departments, and the health department is contacting family members and other people who might have been exposed to the patient during that time.
But no other signs that anyone else has come down with the measles, correct?
Not yet, and yet there is a long incubation period between a week and 3 weeks where people could show the symptoms.
Time to keep eyes open.
It's time to keep eyes open.
Okay. All right, terrific. Thanks so much for joining us.
Thank
we
you.
Appreciate your time.